Hey guys, Dr. Ben here. Let's talk about life and what you can do to be as strong and healthy and vibrant as possible, and how can we prevent or reverse 90% of chronic conditions. I truly believe this. After over 20 years in practice and working with thousands and thousands of patients all over the country and all over the world, I truly believe that if every single person would stabilize their blood sugar, we would see phenomenal changes, even upwards of 90% of our chronic health conditions and our chronic, these immune responses, autoimmune, digestion, brain, Alzheimer's, cancers, all of these different things, 90% of those could be reversed or prevented. And just by stabilizing blood sugar. If any of you out there have done this, if a patient is on here or if someone has started checking their blood sugar, poking their finger because of listening to us, put a comment down below. I truly believe that if this was able to be across the board, right now we're able to use continuous glucose monitors, we're able to slap them on, get them at a really reasonable cost. If we would put that money that we're putting into all of these other things that is going on in today's day and age in the medical model, if we would put money into that, we would prevent and reverse literally trillions of dollars a year in sick care costs. So welcome everybody, love having you on. Pop down below where you guys are watching from, share this page. You know what we're doing? We're almost to 50,000 followers, and within the next couple weeks we're going to hit that. So every single one of you that share one of our videos each day, we're going to look at that, and every day we're going to give one of you guys that shares our videos, that posts and shares it to another person, we're going to give out a book every single day, either my blood sugar book or my brain book. You get to choose which one you want, and if I'm feeling really generous, maybe we'll give two, one of each that day. And so we'll give this out every single day until we hit 50,000 followers on our main page here. So welcome everybody, love having you. Lots of good information. If you check out our YouTube page, a lot of people ask, how do I find, go through all your videos? It's really hard on Facebook. Check out YouTube, our YouTube channel, and we're on almost 500 videos, and those are all alphabetized. You can search those. All right, somebody is at the airport. Sandy, where are you headed? So go ahead and check out that YouTube page. Subscribe to that. We post all of our Facebook videos up onto YouTube as well. So hopefully you can find whatever you're looking for: autoimmune, thyroid, gut, whatever it is. And there's actually a post there. Thanks, Brittany, for popping that one up there. But subscribe to that, and you'll be able to get caught up even if you missed something on Facebook. Those go onto YouTube, and you can watch our videos. You can share those. Some people are not on Facebook, so if you have friends or family that you want to get this information to, get them over to YouTube and subscribe to that channel as well. We are on Instagram also, so some people that aren't on Facebook much but are on Instagram, we're on there as well. Brittany can put a link down below for that one. That is actually under my name, not under our F8 brand. So welcome everybody. Here's the deal. You can prevent or you can repair 90% of chronic health conditions in this country if you start stabilizing blood sugar. Most people think about glucose, think about blood sugar, they think about diabetes. They think about prediabetes, insulin resistance, metabolic syndrome, whatever it's been called and whatever you've heard, even type 3 diabetes, Alzheimer's. Most people think about sugar, blood sugar, glucose, high. High is the problem. But get this, high and low are extremely damaging to the body. The lows, we always say the lows, and especially fast dips, are going to be the #1 stressor to adrenals. So the #1 stressor to the adrenal glands, our stress glands, are going to be these swings, especially the dips. So what does that mean? Every time you go too low with your glucose, you're stressing out your adrenals, you're creating more cortisol. This is why we see in so many people what is called random anxiety. So if you are feeling this spurt of rush, anxiety, adrenaline dump, anything like that, it's usually that blood sugar has gone down. This is the #1 reason why people wake up in the middle of the night and can't get back to sleep. So if any of you are having a trouble getting back to sleep, hey Jane, great to see you in Massachusetts there. If any of you are dealing with this time in the middle of the night, 3 o'clock, 2 o'clock, whatever it is, you wake up, you can't get back to sleep, you are probably dealing with a blood sugar dip. So that blood sugar goes down, kicks out the adrenals, the cortisol goes, and then we get this adrenaline dump and people's minds are racing. They're having a hard time getting back to sleep. I have some women, they put a towel down in their bed before going to sleep because they know they're going to wake up in this flush. But they're 38 years old. And they're not going through menopause, and yet they're having this hot flash, but it's actually an adrenaline dump from that blood sugar swing. So lows are just as bad as highs. This is why some people, intermittent fasting is not okay to be doing. Especially if they have adrenal issues, they are going to be having that problem where going down is going to stress out the adrenals even more. They're already jobs and cars and kids and COVID and presidents and whatever you want to stress about, they're already dealing with those stressors, and then you throw that intermittent fasting on. Oh, go all the way till noon without eating, and you just stress the adrenals out even that much more. So what do we need to do? We need to steady that blood sugar 85 to 110 all day long. Hey Lexi, great to see you. You need to keep that blood sugar as steady as you possibly can. The highs are going to create inflammation. They're going to throw off our hormones. Hey Leo, great to see you. Asthma kicks in all of a sudden. Absolutely. Asthma, adrenals, they go hand in hand almost for sure. If you can calm that blood sugar dip down, have a little snack before bed, a little apple and almond butter, turkey breast and a slice of cheese, something like that, you're probably going to be able to calm that down throughout the night. So we know that inflammation, hormones, that's why women get PCOS, their testosterone starts going up, their DHEA goes up. In men, their testosterone actually goes down, it starts spilling over into estrogen. I always say low testosterone in men is directly proportional to how messed up their blood sugar is and how many blood sugar spikes they're having a day. Hey Tanya, yep, absolutely try the snack before bed. If you've got some kind of a sleep monitor, absolutely go into that sleep app and watch what's happening and see, hey, 2 nights of having that snack before bed, did I have more deep sleep or REM or any of those things? So use the tracking devices. It's a huge part of this process. So hey Lana, great to see you there. So here we go. We've got to prevent that spike because that's excess weight gain, that's the inflammation, it causes neurological disruption and damage like Alzheimer's, and it's going to cause hormone disruption in men and women. The lows, that's the tired, the spacey, the hangry, all of these dips where you're like, man, I'm getting tunnel vision, I can't focus like I need to, all those imbalances that come when we go down. How soon, Lexi, how soon after a meal do you check it? So I like it even 30 to 60 minutes after that meal because a lot of people, they'll spike up, I've seen people hit 180 and be back down to 110 even within an hour. That is very, very stressful on the body. So do it 30 to 60 minutes after a meal. 2 hours is that traditional diabetes one to test, but most people we work on, that's not what we're looking at. It's not that diabetic person. It's this person that's swinging all over the place. We see fatty liver with people that are going up and down. I see way more fatty liver, used to be from drinking, I see way more fatty liver from people that are having blood sugar swings and spikes and drops and dips and all these things than from somebody that's just pre-diabetic or diabetic. So fatty liver is going to go away. Alzheimer's, we know there's a huge blood sugar component to that. We see it with type 3 diabetes is what they call it. So Alzheimer's, dementia, these different neurological degeneration diseases would drop significantly. Cardiovascular disease, we see CRP, which is a huge indicator of potential cardiovascular disease. We see that go down dramatically if somebody's blood sugar stabilizes, their triglycerides, their cholesterol, all these potential inflammatory markers for cardiovascular, heart, stroke, those type of things are going to go down significantly when somebody stabilizes their blood sugar. We're going to see cancer rates go down if people stabilize their blood sugar, because cancer is fed by sugar. Cancer is a metabolic disease. It's not a genetic disease. And that's why the research and all the drugs and all that have failed miserably with cancer. You know, we're pretty much just as bad off as we were 20 years ago. The only difference now is there's more early detection, and so then they can hopefully catch people earlier. But the actual treatment hasn't changed. We're pretty much in the same boat, as many deaths percentage-wise as before, but that's because it's a metabolic disease. It is not necessarily a genetic disease. So cancer rates would go down dramatically. Autoimmune, we know every time the blood sugar spikes up too high or goes down too low, we are going to rev up that immune response and destroy more tissue. So we've got to stabilize our blood sugar. If somebody has autoimmune, you've got to be between that 85 and 110. That's why I brought out glucose monitoring in the first place with our patients, was because I knew that just going off the glycemic index, you know, bananas are bad, blueberries are good, was not enough. We needed to be way more specific in there. So, you know, let me know what other questions you guys have down below there. And remember, tomorrow we're going to be doing our live Q&A at 8:30 Mountain Time. I'm hypoglycemic. This is the one thing I have to keep my attention on. It comes out nowhere sometimes and tries. Yeah. So Lena, sorry, not sure how to say that one, but you know, here's the deal. People hypoglycemic, they think, oh, I just need to eat every hour or two. Well, that's not it. I used to be hypoglycemic. Now I can eat my lunch 12:30 and go until 6 o'clock and not snack in between, because I've learned exactly what percentages of protein, carb, fat, everything I need to do to keep my blood sugar as steady as possible. So it totally can happen. You need to pay attention and learn those things, and you can overcome that hypoglycemia. Should everyone be checking their blood sugar? How do you know if it is out of balance? Absolutely. So every patient that comes through an F8 center, and we do that remotely. I'm talking to somebody in New York next, talking to somebody in Connecticut. We've got our Nashville location, Colorado location. We're opening up a second and third in Tennessee in the next couple months. We're opening up in Denver. So we've got those local, but we can work remotely as well. So every single one of our patients that we work with does glucose monitoring. Absolutely, 100%. You know, we've got a 12-year-old up in Wyoming that we're getting started with. We've got a 84-year-old yesterday we're getting started with. Every single person, we need to know what our glucose is doing. That's why I wrote my book, Blood Sugar Doesn't Lie. Brittany can pop that down below. She'll put a link to that. And again, if you share this video with anybody out there today, we're going to give one of you guys, Brittany, go ahead and we'll send them both books. That'll be great. We'll get them both of those. Endometriosis, absolutely, Jessica. Endometriosis is an inflammatory hormone-based condition. 100% guarantee if somebody stabilizes their blood sugar, there will be improvement. Depends on how far it's gone down and to what extent, how vastly it's gone everywhere. But that endometriosis will absolutely change. That inflammation will change. Those hormones will change in there as well. Colon hydrotherapy, you know, for certain people, especially if they're not having very, very regular bowel movements, absolutely we go down that path. Jane, great to see you. What is too low? When mine is 94, I feel shaky and lightheaded. So some people like Jane there, they've been averaging high for a while. So their set point has actually gone higher than that 85 to 110. But for you, 94 probably feels low. It's like if I was at 74. So your set point might be like 105 to 130 is where your body has kind of gotten used to pulling in enough glucose into the bloodstream. So then if you get down to 94 and your insulin receptors, remember you're insulin resistant, so those insulin receptors aren't working like they're supposed to, so then that glucose isn't getting in. So at 94, it feels like 74 for me. But that will get better. Can blood sugar affect blood pressure? Absolutely. So blood pressure, 9 times out of 10, if somebody comes in with high blood pressure, we stabilize their blood sugar, their blood pressure goes down. Absolutely, 100%. We see that all the time. So, you know, there's other reasons that can be contributing to it, but at least 90% of high blood pressure, you fix somebody's blood sugar, they're going to start losing weight, the inflammation is going to come down. We'll see people's legs that are big and thick and swollen, we'll see those come down dramatically and make some huge, huge changes. So, love having you guys on. I've got to jump, but go ahead and pop any questions down below. We'll be answering those. Share this with anybody anybody you know out there. Let's get you some books. Remember, we're going to hit 50,000 in the next couple weeks here, and we'll have the special prize for anybody that does that. They get a free visit if you're local, brain map as well to that, and we'll review everything, whichever location you're closest to. So love having you guys on. Keep that body strong. Your immune system is designed to function at its optimal. Give it what it needs, stabilize that blood sugar, and you're going to be able to fight anything off that you need to. Take care, guys.